Ladies and gentlemen, today I would like to talk to you about first aid and particularly look at why it is important and why everybody should know about first aid. I will look at this issue with a number of questions. What, when, why and how. So in other words, what is first aid? When do we use first aid? Why should we learn first aid? And how can we learn first aid? So first of all, let's look at what it is. According to the definition given by the Red Cross organisation, first aid is help given to a person who has been hurt or taken ill before they receive medical attention. So in other words, first aid are the steps that somebody might take to reduce somebody's pain or discomfort before they are able to go to a doctor or before the ambulance arrives. Now, first aid can, of course, save lives. When we hear the words first aid, the thing we tend to think about is mouth-to-mouth resuscitation and CPR chest compressions. But more often than not, first aid is in fact help that you give after an everyday accident or injury, or illness, and this can be something as simple as a burn or a cut. So now we have an idea what first aid is. Let's look at when it is used. Now, as I've suggested, first aid is a very broad term, and it is therefore used in a wide range of situations. And these go from the very simple, such as dressing a wound, to the very complex, such as trying to restart somebody's heart using a defibrillator. So these machines, these plates that give electricity to the heart to restart it. Now, even if the issue in question is not something life-threatening, first aid can make a big difference. And to demonstrate this, I would like to look at the issue of burns, because burns are something that can very easily happen. I'm sure you all have experience of burning yourself in the kitchen when you're preparing a nice dinner, but we often don't know exactly what the correct treatment is. So here I would like to tell you what you should do, what first aid steps should be taken after a burn. Now, the first step is perhaps common sense. You should turn on the cold water tap and put the burn under running water. Now, of course, this is probably what most of us do, but what usually happens is we don't keep the burn. Let's say we have a burn on our hand, we don't keep our hand under the running water for long enough, because the recommendation is that the burn should be kept under running water for at least 10 minutes. And the faster and the longer that you can cool a burn, the less impact it will have. So in other words, the less likely it is to cause scarring afterwards. So cold water, cold running water, helps to reduce the pain of a burn, it helps to reduce swelling, and most importantly, it helps to reduce the risk of scarring. And this is particularly important because scarring on a serious burn can in fact lead to great psychological distress in the future. So it is important that the burn is treated as quickly as possible. However, once you have run the burn under cold water, you shouldn't stop there, particularly if it is a serious burn. After running it under cold water, you should cover the burn with cling film, so this plastic kitchen wrap, or with a plastic bag, because the burn is basically an open wound and there is a high risk of infection. So covering it with something clean that won't stick to the skin reduces this risk of infection and again reduces the risk of scarring. So this brings me on to the question of why. Why should we learn first aid? Now, the answer to this should really be obvious. None of us want to be a helpless bystander at the scene of an accident, and nobody wants to watch a loved one suffer from an illness that could be easily treated. So knowing first aid makes us more likely to be able to help in such situations. And the more people who know first aid, the safer all of us are. However, it is important to get training and not just simply apply first aid steps that you think are right, because incorrectly applied first aid can actually make things worse. And to demonstrate this, I would like to give the case of epileptic fits or seizures, because seeing somebody having a seizure most of us have the instinct to hold them down, to stop these convulsions. But doing so can in fact lead to injuries, either to yourself or to the person who is having the seizure. So in fact, the correct thing to do if you witness somebody having a seizure is to make sure their head is protected. So to put a pillow or a jumper under their head, something soft to make sure they don't bang their head on the ground. And also to clear the area to make sure they are protected from anything that could cause an injury. And the third step is to call the emergency services. And this is actually a very important point of first aid. To be able to give good first aid, you should always know the number to dial for the emergency services in the country that you're in. Now, this has been made easier with the introduction by the EU of a common emergency service number, which, in case you don't know it, is 112. So finally, how can we learn first aid? Well, most countries will have organisations offering first aid courses. In the UK, for example, organisations such as the Red Cross or St John's Ambulance offer classes in first aid at a very small fee. You can, as an individual, register to attend day-long classes or evening classes, but they also offer group workshops, which tend to work out even cheaper. So if you have colleagues at work or fellow students at university who are also interested in attending a first aid course, perhaps you could speak to your boss or your university department and ask them to organise a course for you. The Red Cross in the United States even offers online first aid courses using simulation learning. So whichever way you decide to learn about first aid, do take the time and spend a little bit of money to learn these important skills, because who knows, one day it may save a life. Thank you.